These are questions I just created. They don't relate to each other. You just have to look at each individual case and see if you taking care of this patient. Do you think this information is something you should worry about or something you should not care about at all and just continue with what you're doing in terms of patients when they give you a bunch of patients? Sometimes in an NCLEX, they will combine them, but I just want you to look at each case and then think about it. Like you said, each case is isolated. It does not affect the second one. So you have to look at one and say, hey, what is going on with this? So imagine you taking care of a 50-month-old with an open bottle of drain cleaner, right? But the kid is still crying with no obvious distress. Do you think you should worry about it? Right? It's a 50-month-old. But what do you see? Drain cleaner bottle is empty. And kid is crying. Is he not distressed? Do you think you should worry about this patient or you shouldn't worry about this patient? It's a 19-year-old, a 15-month-old. They always put things in their mouth. If the drain cleaner is empty, probably you swallow everything. Drain cleaner can be very corrosive. So most likely this kid, even though she's crying, he or she's crying, no problem, they're going to have issue very quickly. They may aspirate, they may have corrosion of the airway. So this is one of the things when you see it, you should be worried about. It can be set in a way that you think the kid is fine, but I intentionally put the kid is crying. It's telling you I'm in distress. So for this one, you should be concerning. A client with CHF with pink fluid sputum and crackles and long base. Of course, you know about CHF. But what is going on with this individual? Pink fluid sputum and crackles. When you consider a B-sharp movement, you can see that this patient, do you think he's having breathing issue, electrolyte issue, shock sepsis, airway, or pain? Based on that, you can have CHF all the time, right? There's people walking around with CHF all the time. But when you see these pink fluid sputum or crackles in the long base, that means they're having complications with it. The patient is drowning. This become a breathing issue now, right? It's a breathing issue. The tube is not the airway, right? People get confused between a breathing and the airway. If this is your lung with the bronchi, right? Anything that affects this tube is an airway problem. If it affects the lung parenchyma, it's a breathing problem. Patient with pink fluid sputum, that means they're drowning with fluid. The vessels are being ruptured in the lung. So the lung is affecting exchange of oxygen. So that become a breathing problem, but it's not the airway problem. So this is a B. So this issue, I think you should worry about it. So this is concerning. A client with peptic ulcer disease with the sharp, severe abdominal pain, rigidity. There's a bunch of buzzwords, right? Forget about the peptic ulcer disease. Every time they give you this, I tell you, just rewrite the question on your own and figure out. If you have peptic ulcer disease and you come in with the abdominal pain and rigidity, is this acceptable? Is this something you should play with? Is this something that you see all the time? Is this something that is normal, right? For a patient with peptic ulcer disease, right? You have to be sharp. It's not expected. Is this what you expect with peptic ulcer disease? Well, they will have some small epigastric pain, but the presence of rigidity changes everything. This patient is in trouble. It's a serious patient that you should consider paying attention seriously. So that one is also concerning. A client with long bone fracture has Petechia on the chest and GCS of 14. What do you guys think? Petechia and GCS of 14, right? I have a fracture in my leg, long bone fracture, but all of a sudden I have GCS of 14. That means you're confused. and you have petechia on your chest, something is not right. Not everybody who has fracture should have what? Petechia on your chest, and then the GCS of 14. This is the way I want you to think about prioritization. Talk it through yourself and tell yourself, hey, is this what I expect? Like, is this like I have to be sharp? Be sharp means you're thinking about it. Is this what every patient with the long bone fracture coming? Is this what you said? You should see, am I seeing a breathing issue, electrolyte shock, sepsis, airway? Of course. Confusion, DCS of 14. You shouldn't be confused if you have fracture of your long bone. You should not see petechia on your chest if you have fracture of your long bone. How did this happen? It's because you have embolism. And this is fat embolism. Therefore, fat embolism is concerning. And this is the way I want you guys to think about prioritization. No matter what, this is the way you should think about prioritization. A client with chronic liver disease with prolonged prothrombin time and low albumin. Don't worry about it. There's a bunch of words. Highlight the key fact. Step back. Don't memorize anything. Break down the answer choice and see what you have, right? Chronic liver disease. Well, your liver does not work. Is my PT going to be high? Is my albumin going to be low? And you ask yourself, is this like normal to see that in a patient? If that is it, then just run away from it. Don't even look at it anymore, right? Don't look at it. Is this what I will see in a patient with the chronic liver disease to see a prothrombin time that is prolonged and a low albumin? Of course, yes. When you have liver disease, your liver does not make protein. So your albumin is going to be low. If you can't make protein, clotting factors are protein. So you can't clot. So your PT prolong. And this is unexpected finding. You are being sharp if you choose unexpected finding. So this guy. A client post tonsillectomy reports 9 out of 10 throat pain. Ask yourself, if you have tonsillectomy, are you going to have sore throat? It's reporting what? Throat pain, 9 out of 10. We just removed the kid tonsil. Am I going to see somebody with the tonsillectomy, post-tonsillectomy, you're going to have pain 9 out of 10? Is this like something normal? If you don't expect this kid to complain about throat pain, which is 9 out of 10, then pick it. But if you think this is normal for a kid after tonsillectomy, then you high five each other and said, okay, we'll give you some pain medication. Don't worry about it. But don't get trapped. If the board wants you to worry about airway, there's keywords when it comes to tonsillectomy. They will tell you excessive swallowing. This is not the same as throat pain, right? They will tell you they will be gargling at the back of their throat. They are not bleeding, right? Those things are signs of what? Bleeding. Throat pain is expected. I remove your tonsils, you're going to have throat pain. But when you're swallowing excessively and you're coughing, those are signs of airway bleeding. This patient is expected. A client post right-sided thoracotomy. That means I went into your chest. I make incision and went into your chest and did something there. This is the chest wall, and this is your right side. I went here into your lung and fix you things something there. Now, what are you doing? You report 9 out of 10 pain when you take breath. Think about it. 9 out of 10 when you take it breath. When I make incision on your chest is going to hurt. Your ribs is going to hurt. The muscles is going to hurt. When you take breath, you're going to feel pain. This is an expected finding. And you have to like be thinking like that. If you do that, trust me, prioritization will be like not anything you should be scared, because every content there is prioritization. So all your tests is prioritization, your teaching is prioritization, education, all of them. So you know, like, oh, This is what I expect when somebody have thoracotomy. This is what I would teach them about. A client who delivered vaginally 4 hours ago. He has a temperature of 100.4. Like I told you, these are content-related information. I just pick the things I want you to know for every content. And this is what you do with prioritization. They just take it and they put it together and they say, oh, what do you want to do with them? If you go and look at the Q bag, that's what they do. There's nothing to it. So if you deliver right now, 4 hours, your temperature is 100.2. Are you going to be freaking out? Are you going to be worried? Are you going to be asking for antibiotic? Is the content, right? Temperature 24 hours up to 100.4 is expected. This is 100.2. Let's keep on moving. A client with crash injury. Remember, crash injury has dark brown or tea-colored urine, right? Your urine is not supposed to be dark or tea-colored. What has happened? Crash injury. What is going to make your urine dark and tea-colored? It may be what? Hemoglobin, it may be muscle breakdown. When you crash, you have a crash injury, you have injury to the muscle, and the muscle get released. They go to the kidney, they destroy the kidney and the muscle protein, and you have brown, dark, tea-colored urine. This is rhabdomyolysis. This is bad. This is bad. So anybody with the crash injury, what you should worry about is rhabdomyolysis because the kidney is going to be in trouble. That's why you give them a bunch of fluid to wash their kidney out. So dark brown tea-colored urine is bad. So this one, concerning. A client with anxiety as what? Chest tightness, rapid breathing, and excessive sweating. I intentionally said this to make you think. If you have anxiety, don't you have rapid breathing? You'll be excessive sweating, but the presence of chest tightness. Anybody with anxiety, they may give you a case. They say a kid with anxiety disorder came into the emergency room with chest tightness and other signs and symptoms of anxiety. As soon as they say something about chest tightness, you have to rule out cardiac problem. Even though we know this is maybe anxiety, but when they add chest tightness to that, you always want to rule out cardiac origin. So don't forget, just because we think this may be anxiety related, the presence of chest tightness, you have to see this patient as soon as possible. So it's concerning. A client with tuberculosis report numbness, tingling afterward, taking isoniazid, content pharmacology, respiratory, right? You know when you have tuberculosis, you're going to get isoniazid. What is the most expected finding when you take isoniazid? You're going to have numbness and tingliness. What do? Take vitamin B6. That's all. This is not a problem. A 3-month-old with what? Bulging, Fontanelle, and high-pitched cry. Do you expect that in a 3-month-old? They should be chilling, they should be eating, they should be like laughing. But to have a bulging fontanelle and high-pitched cry, something is not right. The kid is not supposed to have shrill cry or high-pitched cry. What do you think? That is not cool. This kid is not happy. High-pitched cry and a bulgy fontanelle is an ICP issue. An ICP problem is always a bad problem. It's a neurological problem. It's an airway problem. When you look at the B-sharp, every neurological problem is an airway because your neural status control your breathing status. So this patient is a problem. Now, this is a trap, right? 24-hour post-thyroidectomy. I remove your thyroid 24 hours. Then you have carpopedal spasm. What is going on? Carpopedal spasm after removal of thyroid. I remove your thyroid. Why all of a sudden you're getting carpopedal spasm? Is it normal to do that? And if it's normal, is it something bad? Sometimes you can have expected finding, but it's still bad. So you still have to worry about this patient. Carpal spasm after thyroidectomy is hypocalcemia. Hypocalcemia is not friendly. They don't like you. Your body does not like hypocalcemia. When your calcium goes down, all your symptoms go up. You become hyper excitable. Your neural status excitable. Your cardiac status excitable. This is not good. We have to worry about it. So this is concerning. 12-week-old gestation. Now she's gained 4 pounds. She's worried. She's worried. She's in your clinic. You said, nurse, I'm 12-week-old. I'm just get pregnant. 12-week-old. Now I've gained 4 pounds. What do I do about this? Help me out here. Is this something you should worry? 4 weeks. She's 12 weeks, and then she says she's gained what? 4 pounds. What are you going to tell this patient? Hey, you should worry about it, or you're going to call the doctor and you said, hey, this is not right. You should not gain 4 pounds. I can tell you, first trimester, you should gain 1.1 to 4.4 pounds. That is expected. She's gained 4 pounds. Good luck with that. Don't worry about it. A client who underwent abdominal hysterectomy, we remove your uterus. We remove your uterus 8 hours ago. All of a sudden, you have calf pain. Ask yourself, always prioritization, try to bring it to your level. You ask yourself, they went to my abdomen and they removed my uterus. All of a sudden, my calf is painful. Why would it happen? I mean, this is like, this is not where they operate on me. If they do surgery in the abdomen and my calf is heading in 8 hours, something is not right. This is pelvic surgery and DVT. You see how they use those information, they use the content. Abdominal hysterectomy is a pelvic surgery. One of the risk factor of pelvic surgery is DVT. What would they do in the prioritization? This is the way they'll put it. They want you to bring your content. So hysterectomy and calf tenderness is concerning. This is DVT. A client posts splenectomy. I remove your spleen. Now you're reporting chills. This is also content. The spleen is responsible for removing certain organism in your body. This is why we get vaccination for Haemophilus, pneumococcal vaccine, and meningococcus. There is a vaccine that everybody needs, and this we do that because your spleen, if you don't have a spleen, you're more likely to get sick from it. So pneumococcus, Haemophilus, and meningococcus. The spleen is responsible for taking those organisms out. If I remove your spleen, you're more likely to have infection. This kid is having post-splenectomy sepsis. This is bad, and this is concerning. A client with Addison disease is getting steroid. His white count is elevated. Are you going to be concerned? What do you think? Is this expected or this is just normal? Go back to the content. Addison, you need steroid. Okay, you're getting steroid. What is happening? Your white count is going up. Is this something as you jump in the air and call the doctor 911? It's expected. When you take steroids, you have leukocytosis. This is not something you should worry about. Side effect of steroid is leukocytosis. So elevated white count is normal. It does not indicate infection. It's an expected finding. There's nothing you can do about it. So that is the side effect of steroid. When you take steroid, your white count go up. Anybody, whether you have Addison disease or not, If you take steroids, your white count goes up. A 6-hour-old baby with a palpable mass in the right groin. What do you guys think? 6-hour-old, born 6 hours ago. And when you check the groin, what is the problem? There's a mass there. What do you think? This is content. I just want you to bring your content. This is the kid. You check the groin area, and there's a mass in the groin. It's born 6-hour-old. It's not even 24 hours. What do you think? 6-hour-old baby with a palpable mass in the groin. What do you think? What do you think? Is this something you should worry about or not? This is normal in a kid. Every kid that is born, especially if it's male, I did not put a boy, but I should have put a boy, but they have palpable hernia. So hernia is normal in a kid. As they go in, I should have put a male there. That would like make it easy. But they may have hernia that most likely is either hernia or just testicular undescended testicles. So those are the two options. Is he an hernia or undescended testicles? Most of them are expected finding. You can have it here. If it's your undescended testicles, it takes some time to go down, or if there's a bulge. And so far as it's not tender, so far as it's not painful, you don't have to worry about it. But most of it is undescended testicles. It's a little bit biased. I should have put a male here. That would have make it easy. By palpable groin mass in a male born 6 hours ago, it may be undescended testicles. So you don't have to worry about it. A 3-day-old term newborn. What is the problem? It has yellow tongue, nose, and sclera. What do you think? 3-day-old. The kid is 3-day-old and has yellow tongue, nose, and sclera. Should you worry about it? Should this patient need emergency surgery? Do we have to do something? 3-day-old, that means 72 hours, right? And the skin looks yellow in the nose and the sclera. That is jaundice. Go to your content. Always prioritization. I said you got to master your content to do prioritization. Ask yourself, don't pick the answer. Ask yourself, if I see jaundice in 72 hours, is this something normal or abnormal? Right? Is it normal or abnormal? Jaundice, the content here is jaundice within 24 hours is bad, right? Within 24 hours is bad. After 24 hours, it's not too much a problem. We'll take care of it, but it's not emergency compared to somebody within 24 hours. So this one is okay. It's not a bad thing. We will take care of it by when you see it in the prioritization or in the regular question, a kid with 24-hour, 72 hours, and they have jaundice, it may be due to trauma during the birth, and the hematoma is being reabsorbed, and then bilirubin showing up and then looking like a jaundice, so you don't have to worry about it. A 1-year-old with upper respiratory infection is receiving salicylate. What do you think? Is a 1-year-old receiving upper respiratory infection. What do you think? Should you worry about this patient? Or is this something is just normal finding? You shouldn't be concerned at all. What do you think? What do you think, guys? He's a 1-year-old. He has upper respiratory infection. He's receiving salicylate. Salicylate is an aspirin product. You should never receive aspirin product. And if you have 1-year-old and you have upper respiratory infection, you should avoid aspirin product. Otherwise, you get Reye's syndrome. Therefore, this one is concerning. And this is 20 questions, right? This is the way I want you guys to think about these kind of questions. I have another one, another 25. I'm not going to do, I'll just do five and then we call it a quit. But these are thinking questions to get you thinking, right? Thinking. Like this one, appendicitis. You have a temperature of 101.5, white count of 12,000. Is this something that should concern you? Well, if you have appendicitis, you're going to have fever. Your white count is going to go up. Don't worry about it. If you just had a baby, postpartum client has moderate what? Lochia rubra with a small clot 24 hours after delivery. Once again, I'm just using content to create questions. Ask yourself, if you just had a baby within 24 hours, are you going to have moderate lochia rubra and there's going to be some clot in it? If you don't expect that, then you have to worry about it. But if you expect it, trust me, this is what they put there, select or apply. Which of the following you should intervene? They can take the same thing and they put it in the prioritization question. If you're taking care of this patient and you see lochia 24 hours and there's some clot, this is what you should expect. Okay. A client with a heart failure, all of a sudden weight gain, 5 pounds in 24 hours. Heart failure, 5 pounds in 24 hours. Heart failure, 5 pounds in 24 hours. Do you expect in this patient, should he worry you? Heart failure patient, they walk around all the time. But as soon as you gain that much of weight within 24 hours, you have what? Exacerbation. It's no more an heart failure, it's an exacerbation. This patient is drowning. Therefore, we should be worried about it. If you have a COPD, your saturation is 90 on roommate. Well, COPD, saturation of 90 roommate, nothing wrong with you. You find the saturation can go to 89, right? It's not the problem, right? So this is fine. A client with the cast reports severe pain, unrelieved by medication, and they have what? Their toes are pale. Think about it, right? Severe pain after cast. And when I give you pain, it does not go away. And your toes are what? Pale. Is this something you should be concerned about? I don't think so that you should let this thing go. This patient has a cast and the toe is blue and pale. Well, that is compartment syndrome, right? And then the last one, then we'll call it, or maybe last two. A client with on metformin report what? Abdominal pain and the deep, rapid breathing. Is this something you should worry about? I'm taking metformin. What are the common side effects of metformin? Is the deep, rapid breathing one of the side effects of metformin? Ask yourself. Then you say, well, I don't think so. But I know one major side effect of metformin, and this is what? Lactic acidosis. You have acidosis. What do you think? Lactic acidosis is metabolic acidosis. Therefore, if you want to control your metabolic acidosis, what will you do? Respiratory alkalosis. Therefore, respiratory alkalosis is what? Deep, rapid breathing. That is what he's doing. So he has metabolic acidosis from lactic acidosis. This is worrisome. And the last one, clients with rheumatoid arthritis has severe morning stiffness, last about an hour. What do you think? Think about it. So these are questions I create for my on-demand. We have over almost 3,000 questions. I use it for my crash course and on-demand. If you want to try them, you can check Adapting because they are hard questions, but critical thinking questions. Of course, it doesn't look like the software everybody's used to, but these are really good questions for you to try. If you subscribe to our on-demand, this is what you can play with these questions. But these are content level questions. Thank you for watching. rheumatoid arthritis, they have morning stiffness. Therefore, you will tell them, hey, lay flat, make sure your bed, your mattress is hard, it's not malleable. You stay straight on your back so that when you wake up, the stiffness is not that bad. So this is expected. Thank you for watching. Good luck in your exams. And if you need more, subscribe to Adapting Class or check out Adapting Class on YouTube or my website for my on-demand and crash course. Take care and good luck. Best of luck. Bye.